Now I'd like to discuss a little bit more of COVID-19 and how we're handling or just not handling it in this country. I'm going to show you two videos and juxtaposed next to each other. They're pretty jarring. One's from yesterday with Donald Trump just being the ignoramus he is, and then today another one from Dr. Fauci, who is an immunologist who heads up the National Institute of Allergy and Infectious Disease, being asked questions by Congress. So let's go to the Donald Trump one first, and then we'll come back and I'll show you the other.
And we're prepared, and we're doing a great job with it, and it will go away. Just stay calm. It will go away. We want to protect our shipping industry, our cruise industry, cruise ships. We want to protect our airline industry, very important. But everybody has to be vigilant and has to be careful. But be calm. It's really working out, and a lot of good things are going to happen. The consumer is ready. The consumer is so powerful in our country with what we've done with tax cuts and regulation cuts and all of those things. The consumer has never been in a better position than they are right now. So a lot of good things are going to happen. Thank you very much.
What on earth is this man talking about? The consumer is powerful. He cut taxes. So, like, keep the taxes low, and if you just go out and buy things, don't worry about any kind of disease affecting you. You got money, he cut your taxes, you're buying stuff, you're good. Like, he's just trying to anything he can to deflect away from the real matter at hand. So he brings up other things that he thinks are good that he's done, and he tries to deflect away from the actual crisis happening. Pretty sad. Let's go to Dr. Fauci now, and then you'll see what I mean by the jarring difference.
Based upon the current trajectory, how many people do you think will get this new virus, and how many people do you think will die?
Cannot predict, and that's.
I know you can't predict, but there must be. We have a graph. We have the beginning of a graph. We know this is going to go up. We have the experience of China. We have the experience of Italy.
Yeah.
Can you give us some projections?
It is going to be totally dependent upon how we respond to it. So I can't give you a number. If we now sit back complacently.
I'm not asking to be complacent. I'm asking for a realistic. I mean, that's what the public is looking for.
I can't give you a realistic number until we put into the factor of how we respond. If we are complacent and don't do really aggressive containment and mitigation, the number could go way up and be involved in many, many millions. If we taught to contain, we could flatten it. So there's no number answer to your question until we act upon it.
So it's pretty good there. I mean, you tell me who you believe. The president who is an ignoramus man-child who does way over his head in this scenario, knows nothing about infectious disease, knows little to nothing about anything really, or the man whose sole expertise and job is about infectious disease and immunology. I think that the choice is pretty clear, right? It's pretty obvious. And Trump's telling us to remain calm. I cut your taxes. And this man is saying, if we don't take the proper steps to do what we need to do, the numbers could explode. And we're not taking the proper steps to do what we need to do. I mean, just look at what the other countries, in particularly China and Italy, have done. And we're not doing any of that. China quarantined entire cities. Italy basically shut down the entire country, and they're both slowly starting to see a decline in cases. They both got testing kits out in mass, drastically and quickly. We've done none of that. We have a president who keeps trying to downplay it because he knows that it's going to hurt the economy, and if economy takes a downturn, that hurts his re-election bid, and that's all he cares about. He doesn't care about your grandfather, your uncle who's got diabetes. He doesn't care about anybody. All he cares about is the economy and how this is going to affect the economy and affect his re-election. But if the economy had nothing to do with getting re-elected, he wouldn't even care about that. And I mean, here we are. It's amazing to me how there are some people who think that the Democrats are trying to engineer this as some sort of hoax against him to hurt him from getting reelected. No one is, and you don't have to engineer anything. Like, supply chains are being broken, the markets are getting destroyed, people are getting sick. Some people, in particularly the elderly, are dying because of it. And I spoke to a friend recently who lives in Italy, and she told me that it's putting massive strain on the Italian medical facilities and officials and their supplies, because it's a lot of the people that come down with it, especially the elderly people, all need to be put in ICU. And then you have people who are already in the ICU for other ailments, and then you have new people going in there for different accidents, and it puts massive strain on the amount of beds that are available, the amount of health officials that can attend to these people, and it's causing, even more panic in that regards. But at least they're taking the steps they need to take in order to reduce the amount of spread. We're not doing it here. And, we can only hope for the best, but I mean, that's nothing but, hoping. If the numbers bear it out, I mean, a lot of people are going to get infected. Most people will be fine from it, yes. But there will be some people who die from it who could have had their death prevented if the proper precautions were put in place. And, it's pretty crazy. We don't have the testing here. Like, for instance, I spoke to someone very close to me who came down with the flu, and they went to the doctor to make sure that they didn't have COVID-19, and also just to get some help to get over the flu. And then their job wanted them to get tested, and they wanted some sort of doctor's note letting the job know that he had been tested for COVID-19 and he doesn't have it and he can come back to work. Well, the doctor doesn't have the tests, and Quest Diagnostics in the area doesn't have the tests. These are the exact words. Quote, "Please note, despite reports in the media, there are no current available/commercially available COVID-19 test kits. I have enclosed correspondence from Quest Labs as confirmation he is not able to obtain such testing." End quote. So this isn't just like, a game that you're hearing from people on the left, and the Democrats are spooking people and trying to bring down the economy. This is like, stuff's really happening. Like, this is where conspiratorial thinking, like I always say, melts your brain. And then you always think that there's some sort of conspiracy behind something that is going on, when really it's just the world that in play. This is just how things work. Things are playing out. There's no conspiracy behind it. There are events that happen that lead to other events. And then you have factual information that you can find that shows you that this is real, and it's not some sort of concocted conspiracy that you've had infiltrate your brain from being on the depths of Reddit and Fox News too long.